all members meeting for, thank you. The all members meeting for the California HPV Vaccination Roundtable. We are so happy to have you here. My name is Shante Davis Patterson, and I'm the program director for California's Comprehensive Cancer Control Program under the California Department of Public Health. And we also administer the State Cancer Coalition, the California Dialogue on Cancer, or CDOC, which is a co-founder of this roundtable. Our virtual all members meetings are a chance for all of our members to hear updates on the work of the roundtable and ways to get involved, learn about relevant updates in the field, and connect with fellow HPV vaccination champions throughout the state. As we get started today, like I said, if you haven't already, please do enter your organization, your name, and something you're looking forward to doing this summer in the chat. Right. So a refresher for those who are newer to the roundtable, the California HPV Vaccination Roundtable is a coalition of diverse stakeholders with a mission to work together to prevent HPV-associated cancers and precancers by increasing HPV vaccination uptake in California. One of our primary aims is to convene stakeholders with different roles to play in advancing HPV vaccination and work to foster connections among these partners. Through work groups and other roundtable projects, through our in-person annual meetings, and through virtual convenings just like this one. We also aim to disseminate evidence-based strategies and resources, and we execute high-impact work that requires collaboration amongst all of us, and we do that through our work group projects and ad hoc efforts. And we'll be reviewing what's currently happening on today's call for all of those things. All right, so let's take a look at the agenda here. Oops, just lost my screen. Oh, there it is. So today we've got Erin Whitney from the Department of Public Health presenting momentarily on some exciting new data on HPV vaccine effectiveness featured recently in MMWR. Our steering committee member, Dr. Mark Sawyer, is going to give us an update on what is being considered by ACIP, HPV Vaccines Workgroup, which I know we're all excited to hear about. Raquel will be sharing some highlights from our recent steering committee strategic planning retreat that we had April 1st, and some of the priorities that came out of that. And then we'll hear from our work group leads that will share updates on the work of our work groups and opportunities to get involved. And then we're going to end with sharing some new resources and opportunities and a save the date for our 2025 annual meeting, already in planning stages. So now we're going to transition over in terms of screens. Oh, there we go. We're already ready for Erin. I am pleased to introduce Erin Whitney to share some exciting new data that adds to the growing body of evidence that we have that HPV vaccination is a cancer prevention vaccine, and we are improving and saving lives with this work. Erin Whitney is the HPV unit chief in the California Department of Public Health, the Sexually Transmitted Diseases Control Branch. Erin manages the HPV impact surveillance effort in California and has done so since its inception in 2007, shortly after the first HPV vaccine was introduced in 2006. Thank you, Erin, for your contributions to the field and to our state roundtable and for presenting for us today. Erin?
Yeah, thank you so much, Shante, for that kind introduction. Shall I go ahead and start sharing my slides?
Yes, go ahead.
And just confirming you're seeing the slideshow? Or are you seeing the notes view?
We can still see your notes. Yeah.
There we go. Okay. Yes. Okay. So, as many of you are aware, February 27th saw the release of the MMWR Morbidity and Mortality Weekly Report that had this report on trends in cervical precancers identified through population-based surveillance, the HPV Impact Project. There are 5 sites around the United States. And we presented trends from 2008 through 2022. And it received some fantastic press and number of headlines. They're really powerful and worth celebrating. It's been a number of years for which this surveillance has been conducted, and it's gratifying to see to report the results and to see the positive press that came from it. So for a quick background, HPV Impact, HPV Vaccine Monitoring and Surveillance, is a CDC-funded effort through the Emerging Infections Program, and in California, it's the California Emerging Infections Program. And since 2008, we have been conducting population-based surveillance of cervical precancer, as well as cervical cancer in collaboration with our California Cancer Registry to evaluate the impact of the HPV vaccines. And so we have monitored incidence trends. We also collect cervical tissue from biopsy and clinical specimens and conduct HPV genotyping to monitor the circulating types. And we also collect HPV vaccine and cervical cancer screening history, and that is in collaboration with the California Immunization Registry Care and through medical record review. It can be quite labor intensive at times, which is why this effort is conducted at 5 sites around the US and in smaller catchment areas and not statewide. So California, Oregon, Tennessee, New York, and Connecticut all have surveillance sites. And in California, we conduct this in Alameda County. It's a diverse county here within the California Emerging Infections Program catchment area. So what we'll be reporting on are the results from all 5 of these sites together. And just a quick review that we are capturing cervical precancer. So this is after a woman has gone in for cervical cancer screening history or cervical cancer screening, and then returns for a biopsy or another procedure on the cervix. And so we're capturing these moderate to severe precancers that you'll see throughout the paper, also called CIN2+ for cervical intraepithelial neoplasia 2 or 3, as well as adenocarcinoma in situ AIS. And we are capturing cancer, but this report included only cervical precancer. So the infographic that was produced, I'm sure you all have seen and hopefully are sharing and using. This infographic just displays the dramatic decline in CIN3, which is that severe precancer right before cancer, in the younger age group, 20 to 24-year-olds. So this is a huge win. CIN2 and 3 had a drop of 79%, so very similar. And of course, the messaging, continues to ensure vaccination by ages 11 to 12. And I just want to highlight that if you look at women 20 to 24-year-olds, back in the earlier days of the surveillance effort, they were eligible for catch-up vaccine. They were aged 13 to 26, but at the time when vaccine came out. But you see another drop here, and those folks were eligible for vaccination at 11 to 12-year-olds at 11 to 12-year-old years of age, back in 2006 when the vaccine first came out. The second piece of the report also highlighted that the first decline in slightly older ages in 25 to 29-year-olds. So CIN3+ decreased 37% among those that were screened ages 25 to 29 years of age. And so that's another huge win. I mean, this is what we want to prevent. And this was a nice parallel to a research letter that came out in JAMA in November 2024 that looked at the National Center for Health Statistics and cancer mortality and cervical cancer mortality in women under the age of 25 years of age. And for those who would have been eligible either for catch-up or recommended age in 2006, you suddenly see this, steeper drop off with a 62% decline in deaths from the years of 2013 to 2015 to 2019, 2021. So that's also, it's a nice parallel to show the impact, the incredibly positive impact of the HPV vaccination program. And then I'll highlight in California, and in Alameda County, when we have done the tissue typing and the HPV genotyping, we found that 7 in 10 women had cervical precancer specimens that contained only the HPV types that were covered by the currently available 9-valent vaccine. So another huge win that's preventable. And we have seen that it has been 8 out of 10 in the past. It was more like 7.5 out of 10, but we didn't want to do a half a woman. So again, like really powerful and good news. And so I just want to acknowledge our CDC colleagues who helped lead that MMWR, our California HPV Impact team, the other sites, and our Alameda County Public Health partners and residents. So thank you so much for the opportunity to share this incredibly good news, and please feel free to share it out.
Awesome. Thank you so much, Erin. All right, so now I'm gonna turn it over to Raquel to give some highlights from our steering committee strategic planning retreat.
I think we went one slide too far, actually. Go back one, and please use the chat. If there's any questions of Erin, please throw them in the chat. So yes, this is a very timely update we want to cover on what the ACIP HPV Vaccines Workgroup is considering currently. Dr. Mark Sawyer is unfortunately not able to be with us today, so huge thank you to Dr. Dean Blumberg from UC Davis, pediatric infectious disease specialist there, who is on our steering committee, who is going to pinch hit here. Thank you, Dean.
Yeah, thank you. Yeah, so I won't give as much richness as Mark would add to this. But as people are aware, there were discussions at the last ACIP meeting on several issues related to HPV vaccine. And in the June meeting, there will be additional discussion, including, most exciting, I think, for a lot of the work we're doing is reducing the number of vaccine doses to 1 dose given routinely in the recommended HPV vaccination schedule, which would really immediately raise up-to-date vaccination rates among adolescents by about 15 or 20%. The modeling on that is really promising and gives very similar expected outcomes in terms of HPV prevalence and cancer reduction. So that's really exciting. The other issue is the wording of the age range for routine vaccination, so that routine vaccination would be 9 to 12 years of age instead of how it is currently, where it's 11 to 12, but can be given down to age 9. So we're all familiar with the vaccine working very well at age 9. We're having a better immune response then, and being able to get kids vaccinated earlier. And then there's going to be additional guidance expected regarding shared clinical decision-making in different age ranges. For example, outside the upper limit of age that the vaccine has FDA labeling for. So outside of that range for special circumstances, given people's individual circumstances. Is there anything else you wanted me to highlight, Raquel?
I think that was it. See if there's any questions. Thank you so much, Dr. Blumberg. Any questions about this? I know we'll all be watching closely, see what happens, and we'll keep the group updated. I believe the meeting is scheduled for the last week of June. So we'll see what gets voted on, and if so, what. Any questions? All right, let's keep moving along then.
Yes, okay. All right. Now, if we can have the next slide there.
I saw a note from Joyce that she had lost connection, so I think she may not be able to progress the slides.
Okay.
Is that something you see?
I still see the work ACIP slide here.
Yeah, let me see if I can share on my end. Hold on, everybody.
And this is Mark Sawyer. I've joined just in time to be late for my presentation. I think my apologies to everybody. I had got distracted.
Well, we're glad that you're here.
Yes, thank you. Yeah, so we have plenty of folks that can answer any questions related to the ACIP happenings if you all want to throw those in the chat. Are we good? Is Joyce controlling this or are you doing it, Shantae?
This is Joyce. I think
Okay.
Joyce is back on. Yeah.
Okay. So,
Joyce, can we get the next slide? Are you able to progress there? Oh, there we go. Okay. So now we're going to dig into what's going on specifically with our state roundtable. The steering committee met in April for a strategic planning retreat, and it's the first time we were able to meet in person as a steering committee since we first launched the roundtable. So it was really exciting to see everyone there. And right now, I'd like to introduce Raquel Arias from the American Cancer Society, who is a longtime member of our steering committee and leadership team, one of our leaders of this roundtable, to share some highlights from this meeting. Raquel.
Thank you. You can go to the next slide, Joyce. So just a reminder, here's who is on our steering committee, and a big thanks to this group, many of which have been with us since we launched the roundtable 6 years ago. This includes our work group leads, which you'll hear from momentarily. And cheers to our newest member of the steering committee, Jennifer Sway from USC. Next slide. This is one more click. This is how just our current structure. We have the steering committee. We do have a leadership team that meets more regularly to move things along. And then we've got our 3 work groups, and one more click. A general membership path as well. So we certainly, many of you on today aren't part of our work groups, but are just, part of this broader community of HPV vaccination stakeholders that we are, so happy to have a platform to convene on and move this work forward. So we'll be hearing about those work groups in a bit. These were our objectives when we met in early April. So certainly to celebrate our strengths and accomplishments as a roundtable, and also to discuss and begin to solve for some of the biggest weaknesses and threats that we as a steering committee identified for our state roundtable. Certainly some of the things that came up as threats. I saw, Adam, your comment in the chat, some of the national context, things that are, out of our control, but we spent a lot of time discussing things that are in our control. One of the weaknesses or threats, depending on how you look at it, funding challenges. Right now we've used had very limited ACS dollars, which have been great to be able to convene for our annual meeting, things like that. Fortunately, we have those again this year, but not wanting to over rely on those. So like financial sustainability was something we talked about as well. A big thing that we started doing and are continuing to do is reassessing just like our purpose or mission statement, overall scope, and then goals as a state roundtable. Assessing, so this is important. If you all were with us in the December annual meeting, December 2024, we did breakout groups where we essentially generated ideas for impactful roundtable projects that could be taken on. So the steering committee assessed those for feasibility and impact, along with some other things that were on the whiteboard. But I want to let you all know that the meat that came out of those work group discussions, or sorry, those breakout discussions in December was definitely used. And then we did also just kind of consider if there were any necessary changes to our roundtable structure, membership model. We ultimately decided, no, it's working pretty well. We're continuously open to feedback on that, but that's just was one of the conclusions. Next step, or next slide. So these are, I know there's a lot on here, I'm going to go slowly. These are coming out of that meeting in April. These are some of the key priorities for the steering committee specifically, of course, pulling in different, the participation and collaboration of different members. But this is what the steering committee will be focused on. And then we'll go into work group updates to talk about what the work groups are going to be focusing on. So like I mentioned, reworking roundtable mission and goals. Our previous goal statement or mission statement, I should say, referenced 80% by 2026. 2026 is right around the corner, so good timing to just take a close look at that and set some feasible goals. Also wanting to use some registry data for that as well, rather than only NAS-TEEN. So the data work group is going to, or is currently advising on some of that. That financial sustainability that I mentioned, exploring additional funding sources. Certainly planning an annual meeting for 2025. That was one of the things we considered, is the impact of those meetings. And we all agree this is a really key value that we're bringing, is to be able to convene stakeholders across the state regularly, for offering those connection points, showcasing the work that's happening in the state, disseminating best practices, all that good stuff. So we'll be doing that again at the end of today. We'll have a update on where we're at with planning for our 2025 annual meeting. And then you'll hear about this more in a second, but building out a comprehensive Start at 9 strategy. We did a lot of discussing about, we've talked, I think if you've been on different roundtable events, the big focus started at 9, starting earlier to increase on-time completion. This maybe helped with what happens with ACIP, we will see. And then also Start at 9 being a really helpful strategy for rural areas where we see a lot of disparity for HPV vaccination rates. Just, less access to getting to the doctor helps to have more time. Also vetting opportunities in 2 newer areas. That's pharmacy located vaccination. We actually just had a call, some of you are on, that some of our pharmacy stakeholders to identify, potential areas for opportunity in the pharmacy space. And then school nurse education, another exciting area that I think not just in the steering committee, but others are probably interested in working on. So if you're interested in either of those 2 newer areas, please, you can reach out to anyone on the steering committee, and we will gladly accept your help and participation in driving that forward. Also support the steering committee priority is working on identifying trusted spokespeople for HPV vaccination. So this is, Margot will talk about this in a second, somewhat in alignment with efforts around California HPV Vaccine Week, but even beyond that, just really having that bench of trusted spokespeople that we can call upon for opportunities to message to the public about the importance of HPV vaccination as cancer prevention. Preparing a policy fact sheet or materials to educate lawmakers, and overall just continuous member recruitment, making sure we've got the stakeholders that the right stakeholders around the table, and engagement as well. So our annual meeting is a key part of that. And so is meetings like today. And then learning from the work and experiences in other states. Just in a couple weeks, a couple of steering committee members are going to be representing California at an ACS. It's called a Top 12 State HPV Engagement Summit, basically for the 12 states that have the highest population of adolescents. Okay, so those are the priorities for the steering committee. And this kind of role, we also talked about work group priorities. And so now we're going to move into hearing from each work group about some of the work that's going on, some of the opportunities that others have the opportunity to get involved with. So I believe we're starting with Hillary from the data work group.
Raquel. Thank you, Raquel. This is going to be very quick because Raquel's already touched on this. Next slide. All right. So as Raquel mentioned, we're heading quickly into 2026, and we've been thoughtfully engaged in discussion over the last few weeks about creating a new mission statement goal for the roundtable. So some of the things under consideration are which age group or age should we use as a marker? Should we look at initiation versus completion? And then when to set the goal for? Is 2030 too close? Do we need to as typo, it should be 2035. So those are some of the things still under discussion. And then I'm happy to say we've had a long journey with our current report. But we appear to be at the end. Adam has been a great partner, and we're working on wrapping up the last of the edits, and we hope to get it over to CUPH for review in the next week or so. So that's where our focus has been. And then also partnering with the cancer, the Dialogue on Cancer group to support them in also setting goals around HPV vaccination. That's it for me. Thank you.
Thank you, Hillary. And we'll move to Julie Dang to talk about the Engaging Health Systems and Providers Workgroup.
Hi, everyone. Next slide. So the California, our Learning Collaborative is still going on. It's every third Wednesday of each quarter. It's from 12 to 12:45, and these are the next 2 sessions we have for the rest of the year. If you're interested in participating as a speaker, please contact us. So the information is on the bottom. We're also looking for those who want to share their projects and lessons learned from any interventions that folks have done to increase HPV vaccination at their organization. And then additionally, if you are interested in facilitating any of these as well, please contact us. Next slide, please. Starting at age 9. So during the meeting that we had last December, the work group had it as a priority to start promoting starting at age 9. So here are some things that we're focusing on for that initiative. So we're currently coordinating a webinar in collaboration with the California Immunization Coalition to be held during the HPV Vaccine Week. So it's going to be a panel of health system presenting their start at age 9 strategies. Currently, we have confirmed 2 health systems. It's Harbor, UCLA, and Kaiser, and we're still recruiting for a FQHC. So if you're interested in sharing some of your lessons learned at the start at age 9 strategies, please contact us as well. And then we're also planning efforts to educate vaccines for children providers on strategies for starting age 9. If you have any questions for that, we're coordinating with Jane. And then announcement approach, we're still promoting the announcement approach. So we need assistance promoting it to health systems, residents and learning collaboratives. And now we have CMEs available for that. Next slide, please. And the Speaker Bureau, so it's live on our website. So if you're interested in being a part of the Speakers Bureau, please let us know. And then these opportunities to provide education and presentations to anyone who's interested in the HPV work. And the last update for us is that our next working group meeting is tomorrow at 2 p.m.
Thank you, Julie. Yes, encourage you all to get involved, especially if you're interested in the Start at 9 work, which is definitely front and center for a lot of the work of this group. And then we'll move to Margot giving an update on work with our parent and increasing parent and community knowledge work group.
Thanks, Raquel. Can you hear me okay?
Yeah, it's a little soft, but I think we can hear you good. Well,
put the volume up there. Okay, awesome. Well, hopefully this is good, solid. Folks can hear. Thanks for the chance to give this update. If you could go to the next slide. Thank you very much. The combined our kind of recent activity and future planning all in one. And like Raquel had set us up at the beginning, you know, really we tried to really pay attention to what came out of the annual meeting and then our steering committee meeting to inform the future steps for this group. I'll talk more about California HPV Vaccine Week in just a minute, but of course that's a core component of this work group's activity, which takes up a good portion of the time through the course of the year. And so we'll invite you into that just momentarily. And updates in some of the other areas that we are active in. We have been taking out, with the help of Lourdes, our HPV 101 or Train the Trainer presentation. I know a few folks on this call have had that or requested that come to their respective organizations. Lord has actually trained over 40 community health workers and health educators from Inland Empire Health Plan. And this training is focused on making sure community members understand what HPV is, its relationship to cancer, and feel confident in their knowledge in the HPV vaccine and where they can get it. And so it's been really exciting to see this training applied, especially with our community health workers who we know are so critical to building trust and reaching folks who maybe are not being reached in the health system. So we're hoping to do more of these trainings. If you're interested, please contact us on how we can do more of these dedicated trainings by organization. And one of our goals, and I'll talk about this a little bit more too, is to feature this during HPV Vaccine Week as well. And then shifting slightly over to our medical assistants. So we had recently shared data on medical assistant vaccine beliefs and misconceptions, and especially related to HPV vaccination, and really trying to galvanize interest in training that is specific and dedicated for medical assistants. And we know there are some resources out there that are tailored to medical assistants, but really trying to expand and scale the training and resources for medical assistants and really engage them as a critical part of the all system, all hands approach to H9, but just HPV vaccination quality improvement in general. And so we have looks like we have some opportunity with CDPH and the PI of the study to look at next steps here. So really excited to take that forward and see where we can go. And then, as Raquel said, one of the key outcomes of our discussion, the steering committee, was looking at building out an HPV resource library that is really tailored more to California and California's population. So we know we have the National Resource Library for HPV vaccination. We really want to look at how we can curate a resource library that's very tailored to California's populations and healthcare environment. So just want to place this here for you to think through what assets you may be working on developing, have developed in-house, whether they're branded or unbranded. You know, what have you come up with in your research and your programming that is addressing the need to reach California communities? So just wanted to plant that seed with you. We can go to the next slide. And just to remind you all, California HPV Vaccine Week is coming right up, August 3rd through 9th, 2025. It's the first full week of August. I can put the link in the chat for the website. If you've been to the Roundtable website, we do have a dedicated page just on HPV Vaccine Week. And this is a chance for you to see the full scope of the toolkit that we prepare every year. So what we're doing right now is refreshing that toolkit, that campaign guide that we work on each year. If you'd like to be part of this effort, please contact myself or Bridget or any leadership of the Roundtable. This is really a critical part of our overall success of the activity, is making sure the messaging is relevant, it's timely, it is tailored to what you're hearing from your constituents. We're working also to record new survivor testimonials for those who've been impacted by HPV cancers. As others have said, we are building a roster of media spokespeople. So the Bureau is already up and running, which is great. So there's a really acute need for people willing to speak for this week so that we can help raise awareness and have credible, engaged speakers talk to media about this during the week, before the week, maybe even after the week during Immunization Awareness Month. So if you're feeling, if it's something you can do and you're feeling confident to do, we would love to have you. Please let us know if you're interested in this. We're also looking to see if we can secure supportive statements from government officials and policymakers, as well as issue a press release. We are, as we said, working to create a resource library alongside this large, our toolkit and campaign effort. And we're also going to support educational webinars during the week. So Julie mentioned the collaboration with CIC. We would like to also feature a spotlight on the work with community health workers, which I think will be very needed and valid, distinct conversation, as well as the conversations and webinars we have with CIC that week. So we're really excited to spotlight that work. And we can go to the next slide. and I'll go quick. I know I've been slow. So how can you help us? You can sign up to be a media speaker. You can promote and share the campaign toolkit. You can use the toolkit in your organization, not just share it. If you want to join the planning committee, please contact myself and Bridget. I'll have more in just a second on that. And then if you can share your own resources and assets, if you need to use your own branded materials, if you can do anything in alignment with that week to raise awareness, to get the word out, whatever you do is super, super appreciated. And it doesn't have to be our stuff. We appreciate it if it is, it doesn't have to be. So thank you for anything you can do to help kind of rise the tide of awareness during this week. And we can go to the next one. And then we would love to have you. So if you're willing to join the planning committee, we're looking at meeting about every 2 weeks or so from now through August. You do not have to be at every meeting, but if you're interested and passionate about supporting the specific planning endeavor, those meetings are intended to just keep us all aligned and convening regularly. But you can communicate with us by email as well. And whatever skills you have to bring to the table are very appreciated. If you have experience with media and press releases, that is especially appreciated, but all skills are appreciated. So we really welcome more hands on deck to support this effort, support the build out of the campaign toolkit, and please reach out to myself or Bridget if you are interested. And so thanks so much for the time here, and please let me know if you have questions.
Thank you, Margot. There is one question in the chat. You kind of answered it, but if you could recap. The question from Adriana, is there another opportunity to get the HPV 101 Train the Trainer presentation?
Yes, the answer is yes, and probably in a few different formats. So if you'd like us to deliver this directly to your organization, we could, I think, most easily do that virtually, but I'm sure could coordinate something in person depending on where you are in the state and what the need is. And then there's also the physical materials, the literal materials we have that we can very happily share with you if you feel comfortable conducting something, on your own time within your own organization. So yes, yes, and yes. And then our plan is to host and support a more public-facing version of the Train the Trainer during August. So there'll be lots of opportunity to get the training, see the training, and participate in the training.
Thank you. Lots going on with our work groups and plenty of opportunities to get involved. So if you have any questions about that, we're also happy to answer and help navigate. We'll put in a more general mailbox email in the chat here in a moment. So I'm just going to go over a couple new resources that we wanted to highlight, and then some available just like national opportunities, many of which are happening through ACS nationally, but are available to us. So first, this CDPH resource, new resource tailored to youth. Really love this piece. So thank you to our CDPH folks for your work on this. So this is this resource tailored directly to adolescents, and then just like as a broader context, the CDPH website does have a section dedicated to the Cancer Prevention Act, which for those that don't know, this is what the act that took effect last year. It requires schools to notify 6th grade students and their parents or guardians that they are advised to follow HPV immunization guidelines before starting 8th grade. So not an immunization mandate, right? It's an educational requirement. But CDPH has this great, that was lit. Yeah, it's going to be linked in the when we send the deck, or maybe Jane, you can drop that in the chat. But this section of the website has this piece in addition to template letter to families for schools to use, robocall scripts. So lots there about the act itself too, if that's newer to you. Next slide. Also a new resource from the American Cancer Society is this HPV vaccination communication toolkit. So it's labeled as a resource for health plans, but it's really not just for health plans. It has a lot of really great communication resources, some kind of plug and play language for both parents and providers, and just a lot, kind of a one-stop shop when it comes to communication resources for reaching out to, again, both providers and more public, parents specifically, not too much directly to adolescents here. So that's going to be linked for you as well. Next slide. And then a couple of those national opportunities. There is a HPV Vaccination Promising Practices series. The next session is on June 25th. This is just like a come one, come all webinar that really focuses on promising practices, as the name would suggest. And so you can see there's a dive into different types of interventions. Systems interventions will be at June, and then provider and patient interventions following that. So this is open to all. You are welcome to participate individually and then share this broadly within your organization's provider networks, etc. Next slide. And then there is also a HPV vaccination rural learning community that's running right now. It started in March, but this is a kind of join anytime opportunity. There's also like a bank of the recordings if anyone wanted to go back and participate. This is for any stakeholder in a rural setting that is working to advance HPV vaccination. So certainly for healthcare delivery system participants, but also health plans, public health, a lot of participation from local public health departments. So rural health and HPV vaccination, just that focus is this is the second year too, so it was very well received last year. This is again open to all. Next slide. And then this opportunity is actually closed for new participants, but I wanted to include it in here because we have really strong participation from California in this. So this is it's all kind of the same terminology. So bear with me. It's called the Health System Learning Community. And but this is focused on actual healthcare delivery systems, those that are putting shots in arms and offering some support. So ACS offering some support on a national level as these different settings. A lot of FQHC participants are looking at their rates and looking to identify strategies to improve those rates. So offering a layer of support to those participants. So thank you for all who helped disseminate this. We do have 10 systems participating from California, which I believe is higher than any other state. Next slide. All right, I'm gonna hand it back over to Shantae for this.
Right, thank you, Raquel. Okay, so our 2025 annual meeting will be an in-person meeting again. We will be having it in Los Angeles, California at the Endowment Center for Healthy Communities, where we actually had our 2023 meeting. Right now, the date is pending, but we are anticipating that it will be early December. So just keep an eye out on that because we'll be sending out a save the date when we do confirm the date. And also, we are also wanting your opinion on just what the types of speakers you'd like to see at that meeting and the types of things you want to hear about. So we have an evaluation to collect that feedback, which is also to help us evaluate this meeting as well. So are we going to launch the poll now to get that feedback?
Maybe we have, since we have a little bit of time, maybe if there's just any questions or discussion before we do that.
Okay, let's do that. We are coming to the end of all of the information we'd like to share for this meeting. And so as part of this meeting as well, we wanted to open it up to any questions, if anyone wants to ask any questions of any of our members of us at the roundtable for our activities, etc. I see something in the chat from Pamela.
Yeah, it's good information, Pamela. If you can come off mute and share it verbally, I don't know if you're in a position to do that.
Hi, everyone. It's Pamela. Good to see you guys again. It's been a bit of a while.
Yes,
I really I've been one of as the founder of HPV and Me, I've been one of the first members of the roundtable, and I'm just really happy to see how much the work has evolved. And Raquel and Shantae, you've been there since day one, and I love seeing how we've started from an idea and really developed it into programs and, you know, building awareness and all of that. I just wanted to pipe in while we have an audience here to talk about HPV oropharyngeal cancers and throat cancer and anal cancer, because I know cervical cancer gets a lot of attention, and we're so lucky to see that cervical cancers have declined. At the same time, throat cancer, head and neck cancers cases have risen. And so that's where most of my work is focused. And so I'm just wanted to put that out there to people, that if you have, you know, just to put that on your radar, that those types of cases are things that we need to also be aware of. I hear from patients and caregivers regularly that are battling this horrible cancer, and the treatment is extremely grueling, and it needs attention so that we can increase vaccination rates and like all kinds of HPV cancers, hopefully eliminate them in future generations.
Thank you. Very important. Pamela was our OG parent work group lead. So thank you for being such a strong advocate.
Of course.
Any other questions or discussion points? I do see a question about how to join a work group. Excellent question. You can certainly email us generally, but I just responded to it in the chat here. Another way, an even better way to give us some context on your interest is to actually fill out the application to join the roundtable, even though you're already connected. But basically, it's just a way to give us an idea of what your experiences are, what you're interested in, which work groups you're interested in, and then we can connect.
Any other questions? Feel free to take yourselves off of mute if you have a question, or drop in the chat as others have.
Shante, can you repeat the dates of the upcoming learning collaboratives, please?
Sure. For July, we will, it's July 16th for July, and for October, it's October 15th.
I'm sorry, October what?
15th.
Thank you.
1-5, yes.
Got it.
Thank you, Julie. And while we're on and talking about the Learning Collaborative, we just confirmed the topic for our July 16th meeting. Margot, do you mind coming off of mute and just giving a quick summary of what will be presented for the July 16th collaborative meeting?
Yeah, thanks, Shante, and thank you, and Susan, for the opportunity. So, actually referencing one of the items that was in our slides, the topic of medical assistance and their, the power and the potency of engaging medical assistance as a key piece of our HPV vaccination quality improvement efforts. My boss, I think many of you know her, Dr. Corinne McDaniels-Davidson. She's the Deputy Associate Director for Community Outreach and Engagement at Morse Cancer Center at UC San Diego. This is her research, and it was an effort kind of undertaken through the end of last year into the beginning of this year, analyzing surveys from MAs, LVNs, and CNAs, actually, to just make sure we represent everybody. The bulk of the respondents were MAs. And so this will be an update from her on the analysis from the study, examining who MAs are in California and how they mirror our populations, and where there's opportunity to engage and educate MAs as a key piece and a key player in advancing HPV vaccination efforts in the state. So she'll be giving that update.
Awesome. Thank you so much, Margot.
Thanks, Shante.
All right. Any other questions that anyone has, or discussion points?
We look forward to seeing hopefully many of you in early December.
Yes. Okay. So now I think we can throw up the poll, Joyce. There we are. So we'd like to gather some feedback, and if you don't mind, since we are still within the hour, we'd like to take the time now to collect it. So go ahead and please answer the poll that's on your screen. I only see 7 people participating so far.
The poll, please.
I know we all multitask on these meetings, but we'd really love your opinion if you can just take 2 minutes for us here.
Yeah, I'm sorry if you mentioned this, but the last question is asking for content ideas for the in-person annual meeting in December. So would love to get your thoughts on that. Oh, that's great. Joyce put it in the chat too, so people will have access.
Nice. Just going to give folks a couple minutes to fill that out there.
It is not scrolling very nicely for me, so I'm trying to get to my next question and it doesn't want to go. I think I found it.
All right. I want to thank everyone for answering that poll for us. We really appreciate it. As well as spending time with us during this lunch hour. We're really appreciative of your time, and your contributions that you've made to this roundtable. Together, we can create the first generation free from HPV cancers. So thank you for your partnership.
Thanks, everybody. Have a good one.
Thank you.
Thank
Thanks, Jesse.
you.
Thanks, Raquel.